Mr. Nader, perhaps you could just give us an example from the state of Texas, what it takes to get on the ballot.
The primary in Texas is March 4th, and we have about 2 months to get about 140,000 signatures because the state arbitrarily and on vague criteria can disqualify thousands of signatures. So as an independent candidate, we have to get 68,000 signatures verified. Now when you're on the street with the clipboards, under Texas law, if Texans voted in the primary on March 4th, they cannot sign the petition to get you on the ballot as a candidate for president. in nearby Arizona, which has now been invalidated, we won a Ninth Circuit case. We're starting to win litigation here, finally. And Arizona said petitioners have to be resident of Arizona to collect signatures for federal office seekers. That doesn't make sense. People want to bring in their friends from Texas, Oklahoma, New Mexico. It's banned. They can be prosecuted. In Oklahoma, someone wanted to put an initiative on the ballot. The Attorney General indicted them for a crime. They may go to jail. Why? Because they had petitioners, some of them were from out of state. I mean, this is Jim Crow laws. We've seen this before against African Americans. Only this time, it's against small candidates and third parties. The only people really who provide a competitive push, a tugboat push or pull to the two stodgy parties who are looking more and more alike.
Thank you. The last question concerns health care. There are differences, certainly, between Senator Obama and Senator McCain's health care plans. However, each seeks to work with health care corporations that profit from illnesses and the sickness of tens of millions of Americans. Senators Obama and McCain, in essence, claim that they can coax these for-profit health care corporations, all of which are listed on the stock exchange and formed to maximize profit, to transform themselves into social service agencies that will provide adequate health care for Americans. Physicians for a National Health Program in Harvard Medical School estimated that we would save $350 billion a year with a national health plan. But since Medicare does not make campaign contributions, and these private health care companies do, with medical and insurance interests giving Barack Obama $708,000 between 2001 and 2006, we hear no discussion in this national campaign between Republicans and Democrats about a national single-payer, not-for-profit health care insurance program. Dr. John Gaiman, the former chair of family medicine at the University of Washington and author of Do Not Resuscitate, Why the Health Industry is Dying and How We Must Replace It, argues that the attempt by Senator McCain and Senator Obama to tweak the for-profit health care system will not work because the for-profit health care companies will always fragment risk pools, essentially not insuring those likely to have serious illness, to make money. He writes that its administrative costs will always be 5 to 8 times higher than public financing through Medicare, and finally its loyalty will always be to its shareholders rather than to its enrollees and patients. We clearly face a crisis, 46 million Americans without coverage, tens of millions of additional Americans with inadequate health care policies that will not cover catastrophic illnesses, and Dr. Gaiman writes that especially with premiums up 87% since 2000, health care is simply becoming impossible to afford for millions of Americans. They simply don't have the money to be insured. Can you comment on the health care plans of the two candidates? Can you tell us how your plans would differ from the candidates, and how you would deal with a for-profit health care industry that has spent tens of millions of dollars on lobbying groups in Washington to destroy the possibility of a national health care plan and to resist any kind of regulation? Mr. Baldwin.
Yeah, I think when you look at the health care plans as promoted by both these senators, I think you have to acknowledge, and this is going to be probably an area where Ralph and I are going to differ somewhat, I think you have to acknowledge that however it's carved, both the Democratic plan and the Republican plan are calling for more and more government intervention. It's more and more socialism. I remember, so I don't remember who said it, but I love what he said. He said, you know, there's no problem so bad that government cannot make worse. And I think that's what we have going on in a whole variety of issues. We started talking about the financial bailout and how that we're socializing our financial systems. Now then we're hearing calls for socialized medicine, not just from the Democrat side of the aisle, but also from the Republicans. They may not come out and blatantly use those terms, but the essence of what they're proposing is more government interventionism. Our position is that the constitutional government requires free market to work. We believe that health care would be more affordable. It would be better maintained if government got out of it. We believe that the free market system will, in the end, provide a better system than anything the government chooses to mix with it. You know, most of us that are a little bit older here in this audience can remember there was a time whenever most Americans could afford to go to the doctor. They didn't have to sell their car to do it, or not buy groceries to get their health care. There was a time when health care was affordable, and even the common person without insurance could afford it for the most part. All of this has evolved because of the integration of
We'll go
government.
back to this issue. Let's get Mr. Nader just to do his 90-second response.
Well, Senator Obama and Senator McCain leave the present system intact, dominated by giant health insurance companies like Aetna and Cigna, who have a perverse market incentive to deny claims, restrict claims, exclude different kinds of ailments, and have this notorious pre-existing condition affect these policies and all their fine print. Healthcare is very similar to fire prevention and police security. People die. People get sick. People get sicker. People have injuries that are not treated because they can't afford health insurance. The Institute of Medicine, the National Academy of Science, estimates 18,000 Americans die every year because they can't afford health insurance. That's 6 9/11s every year. Over 1 million people since President Truman first proposed universal health care. This is not socialized medicine when you talk about single payer. It is full government insurance with private delivery of health care, free choice of doctor and hospital, which the HMO corporations do not allow you these days, and quality and cost controls. A pay or die system cannot be justified on market fundamentalism. It's too cruel. There's $230 billion of computerized billing fraud and abuse, $350 billion of corporate bureaucratic expenses that can be saved and put toward covering people who are not now covered.